Hi, this is Brian Kim. I'm going to share with you case number 98 in the best way to do cataract surgery series. This is a sticky white cataract. And the reason why the sticky cataracts are a challenge is when you're trying to chop the lenses, they don't want to chop cleanly. When you're trying to pull the pieces up out of the bag, they don't want to come up cleanly. They don't want to come up at all, or they come up and they're still adherent to various adjacent lens materials. So it can be quite a bit of a challenge to deal with this sticky lens case, and so you'll be able to see how I manage this sticky white cataract. And so I'm using a cotton tip to straighten the eye and then using a corneal marker, which will hopefully allow me to get a well-centered and sized rhexis. I'm using a paracentesis blade to make my incision first on the right side and then the left side, making sure I'm making an incision flat to the iris plane, which will allow me to achieve a corneal shelf and a self-sealing incision. This is some intracameral lidocaine and then some intracameral air. And then I'm using Trypan blue to paint the anterior capsule surface. I don't want to be aggressive with the Trypan blue and using the cannula as like a paint roller. Now I'm going to inject some dispersive viscoelastic starting from the contralateral side to push the bubble and the dye out. And I'm using the cannula to hold the eye, and this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, turn the eye towards me with the cannula, and then I enter. I push some more viscoelastic in before I come out. And this is the puncture style rhexis. I go in with the forceps with the teeth sideways, and I puncture the center. Grab the right side of the tear, and then I go around to create the flap. I periodically grab and re-grab, and I'm trying to use the mark that I made as a guide to achieve a well-centered and sized rhexis. Okay, burp some viscoelastic out, and this is the capsulorhexis hydrodissection technique. I place the cannula under the rhexis edge contra-incisionally, point the tip down into the capsulorhexis, get a nice wave, come out, decompress on the left side, and then I start to turn the lens with the cannula on the right side, pointing the tip down there. Irrigate the surface of the cornea, positioning the sleeve, lifting the incision with the chopper, going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, clearing that stuff out, placing the chopper under the rhexis edge contra-incisionally, the phaco tip vertically sub-incisionally, bisecting the lens in half, placing the chopper around the right heminucleus, pulling it centrally against the phaco tip, which cuts the right heminucleus in half. That first quadrant just came right up and I emulsified it. I used a chopper to hook the second quadrant up out of the bag and then emulsified it. Turning the second heminucleus in front of me, placing the chopper around the lens piece and then cutting it in half, emulsifying that third quadrant, using a little bit of vacuum to pull the fourth quadrant up. Then I'm able to emulsify the lens piece. So the endonucleus came out pretty easily. That was really not too difficult at all. But you can see this epinucleus is a little bit on the sticky side. I'm able to prolapse it up pretty nicely there. So I take the chopper out, push BSS in, take the phaco tip out, and go in with the INA handpiece. Start sub-incisionally removing the cortical material from anterior to posterior. Peeling it from anterior to posterior allows for a cleaner removal of the lens material. The switch to polish mode, getting into the capsule fornix there, deeper there, to get in your residual lens material. Polishing the posterior capsule as well. So I pulsed some BSS into the subincisional space with a cannula. It's fairly clean in this case. And then I pushed some cohesive viscoelastic to fill the bag. And then using the capsule sweep to polish under the rhexis edge. This is the single piece acrylic lens. It's going to go into the capsular bag. Go in with irrigation off, activate irrigation, making sure the haptics are disengaged from the optic, getting under the optic, tilting it, rotating it 90 degrees, removing all the viscoelastic from within the bag. Repositing the optic back, polishing underneath the rhexis edge, turning the haptics horizontally, and then I'll hydrate my incision. So again, this is a pretty standard cataract. This was fairly soft, but it was a little bit sticky. Not sticky compared to some others, but the point is that stickiness can undermine your ability to disassemble the lens. You saw the double chop, cross chop mechanical fracturing techniques, the way I paint the Trypan on the anterior capsule surface without overfilling the eye with the Trypan to reduce it going into the posterior segment. Using mechanical forces to crush the lens pieces into smaller pieces and reducing ultrasonic energy use, and this patient did well. So I hope this was helpful to you, and I thank you for your attention.